Okay, welcome to you all. Today's topic of discussion is on Parkinsonism disease. Parkinsonism disease. So Parkinsonism disease is very important. Okay, so Parkinson's disease is very important disease. Okay, so Parkinson is a disease of the old age. Okay, so it's a neurodegenerative condition. It's a neurodegenerative condition that involves the progressive depletion of the dopaminergic neurons in the basal ganglia. So what happens is basically there is a basal ganglia. So we know the parts of basal ganglia, the putamen, okay, caudate nucleus. Okay, so there are different parts of the, and there are basically dopaminergic neurons in the basal ganglia. So there is degeneration of these dopaminergic neurons in the basal ganglia, and that leads to resting tremors. That leads to resting tremors, and that leads to severe manifestations. Okay, different other manifestation which we'll be talking about. Okay, so the Parkinsonism disease is commonly manifest at the age of more than 60 years. So it's a disease of the old age. Okay, it's a disease of the old age. So what happens is basically the etiopathogens of why would there even be Parkinsonism disease? Okay, why Parkinson? Why Parkinson? So Parkinson happens because of why Parkinson? So Parkinson happens because of it is an idiopathic reason. So there is basically an idiopathic reason of Parkinsonism. So we basically don't know the reason. We basically don't know the reason for Parkinsonism. Okay. So there is secondly there is a genetic factor. So there is something which is known as a genetic factor. In the genetic factor, what happens is there is alpha synuclein. Okay, alpha synuclein, so it is known as SNCA. Okay, alpha synuclein, and there is basically Levy body. Okay, Levy body. There is basically Levy bodies. Okay, alpha synuclein and Levy bodies. Okay, and there is something which is known as secondary Parkinsonism. So secondary Parkinsonism is secondary to certain drugs like Parkinsonism is secondary to certain drugs like maybe haloperidol, metoclopramide. Okay, it's secondary to trauma. Okay, it's secondary to increase in the level of PTH, decrease in the level of PTH and manganese. Okay, Okay, so these are basically different factors which contribute to Parkinsonism disease. Okay, so the signs of Parkinsonism develops over more than 10 years. So whenever there is, it's not like degeneration occurs in one day and the features occurs in one day. Okay, so it basically takes time. So it takes more than 10 years time for the features to develop of Parkinsonism. And the motor signs are unilateral at onset. So whenever we talk about the motor signs are actually unilateral at onset. Okay, so it's unilateral at onset. Okay, and it's asymmetrical motor signs. Okay, so you have to write this. Okay, so there is an asymmetrical motor sign. Motor sign is unilateral on onset, and there is an asymmetrical motor sign. Okay, and remember more than 20 years earlier than motor signs. So what happens, like motor signs takes time to appear. It is unilateral at onset. Okay, and it's a asymmetrical motor signs. Okay, so what are the different motor signs? We'll be discussing about the different motor signs. Okay, for now you need to remember that motor signs appear and it is asymmetrical. Okay, and more than 20 years, what is seen is more than 20 years, what you see constipation. So constipation is basically the earliest sign. Okay, earliest symptom is constipation. And there is anosmia. There is sleep disturbance, and there is mood disorders. Okay, so there is constipation, there is anosmia, there is sleep disturbance, and there is mood disorders. Okay, so please be clear on all this. Okay, so more than 20 years earlier than the motor signs. Okay, so there is constipation, anosmia, sleep disturbance, mood disorders. Okay, and so there is motor signs. So what are the different motor signs? So the different motor signs that you can see is basically, okay, bradykinesia, there is rigidity, and there is resting tremors. Okay, so bradykinesia, rigidity, and resting tremors. Okay, so there is basically bradykinesia, rigidity, and resting tremors. Bradykinesia, rigidity, and resting tremors. Okay, and what do you expect other signs? So bradykinesia means there is a decrease in the speed, there is decrease in the speed and decrease in the amplitude of movement. Okay, so once again, Parkinsonism is a disease. It's a neurodegenerative condition where what happens is there's a degeneration of the dopaminergic neurons in the basal ganglia. There's caudate nucleus. There is putamen fibers. Okay, and what happens is why there is Parkinsonism. Parkinsonism is idiopathic condition. So there might be genetic factors like there's a Lewy body component, and secondary dementia is to certain drugs like haloperidol or metoclopramide. Okay, or secondary to some sort of trauma or increase or decrease in the PTS, and there is a manganese component, right? And more than 10 years there is motor signs. Okay, more than 10 years you can see motor signs. Okay, motor signs is unilateral at onset. Motor signs is unilateral at onset, you know? So there is a asymmetrical motor sign. Okay, asymmetrical motor sign is unilateral at onset. And more than 20 years, what is there? There is basically constipation, there is anosmia, there is sleep disturbance, and there is mood disorders. Okay, now let's talk about bradykinesia. So bradykinesia, what you need to understand is whenever we talk about bradykinesia, bradykinesia means slow speed. Okay, so there is a decreased sleep, there is a decreased speed, there is a decreased amplitude of movement, a kinetic mutism, hypomimia, and hypophonia. Okay, so hypomimia, hypophonia, akinetic mutism, decrease in amplitude of movement and decrease in speed. Okay, and rigidity. So when we talk about resting tremors, so resting tremors, there is a pill rolling tremor. Okay, there is a pill rolling tremor. Pill rolling tremor. Okay, so it subsides with the voluntary movement. Okay, it subsides with the voluntary movement. Okay, and it is asymmetrical and it disappears as sleep. Okay, so resting tremors is pill rolling type of tremor. It subsides with voluntary movement, it is asymmetrical, and it disappears at sleep. Okay, so and there is this rigidity. So what is this rigidity? This rigidity is increased and persistent resistant to passive joint movement independent of speed. Okay, so it's an increased and persistent resistance to passive joint movement. So it can be demonstrated by two signs: Froment's maneuver and cogwheel rigidity. Okay, and you can also write lead pipe rigidity. Okay, now so let's revise. Okay, so whenever we talk about Parkinsonism is a neurodegenerative condition. So it occurs in more than 60 years of age. Okay, so basically there are certain dopaminergic neurons in the basal ganglia, in the putamen, in the caudate nucleus. Okay, so what happens is why there is Parkinsonism? It is a idiopathic condition. There are certain genetic factors which are responsible. So there is a Lewy bodies, and because of this Lewy bodies degeneration, it can lead to Parkinsonism. Secondary Parkinsonism is secondary to haloperidol, metoclopramide. Okay, there might be trauma, there might be decrease or increase in the level of PTS. Manganese is an important factor. Motor signs are basically unilateral at onset, and asymmetrical motor signs are seen. More than 20 years, you can see constipation is seen. There is anosmia, sleep disturbance, and mood disorders. Okay, so whenever we talk about motor signs, there is bradykinesia. So we have to understand about the three motor important signs. One is bradykinesia, one is rigidity, other one is resting tremor. So bradykinesia means decrease in the speed, decrease in the amplitude of movement, akinetic mutism, and hypomimia and hypophagia. Okay, and rigidity means there is a Froment sign or cogwheel rigidity. Resting tremors, remember the classical feature that this resting tremors, it tends to disappear when at sleep. Okay, it disappears when at sleep, and it subsides with the voluntary activity. Okay, so this is basically a pill rolling type of tremor. Okay, the pill rolling type of tremor. Now let's talk about the postural instability. So the postural instability is the tendency to fall. Okay, the tendency to fall is the postural instability, and there is something which is known as a pull test. So what we can do is we can go for a pull test. Okay, so we can go for a pull test. Okay, pull test can be done. Okay, and Parkinson's gait, it's a snuffing gait with quick and short steps. Okay, you have to write this in this language itself. So what is it? It is a snuffing gait. It's a snuffing gait. It's a snuffing gait with quick and short steps. Okay, so it's a snuffing gait with a quick and short steps. Okay, so increase number of steps for turning around. So whenever turning around, you take an increased number of steps. Okay, while turning around. Okay, now Parkinson's gait, there is freezing, fascination, propulsion, and decreased arm swing. Okay, so what does this mean? Please understand. Freezing, fascination, propulsion, and decreased arm swing. Okay, so freezing means inability to start or continue the movement. Okay, so the person is not able to start the movement is the freezing. Fascination means small, increasingly quick steps. Okay, please write it down. Freezing means inability to start or continue movement. Fascination means small, increasingly quick steps. Propulsion means forward leaning gait, stooped posture, and decreased arm swing. That means whenever you walk, the arm swing is decreased. Okay, there is important factors. One is micrographia. So basically, if you write it down, there is some small writing like this, micrographia, and there is hypomimia. So hypomimia means low degree of facial expression. Okay, next is on shy dragger syndrome. So what is shy dragger syndrome? You need to remember all these words. Okay, shy dragger syndrome means if there is Parkinsonism with autonomic features. So if there is Parkinsonism with autonomic features, we consider it as a shy dragger syndrome. Autonomic symptoms, let's write. Sorry for the disturbance. So autonomic symptoms can be classified into urinary incontinence, erectile dysfunction, and orthostatic hypotension. Okay, next is Parkinson's dementia. There is something which is known as Parkinson's dementia. So what is Parkinson's dementia? So occurs years later, similar to Alzheimer's dementia. There is rigidity, there is visual hallucination, and there is fluctuation in lucidity. Okay, so it is very difficult to manage. So the next video that we will be doing is on diagnosis and treatment. Okay, So for now, let us revise the things that we have studied till now. Very very important, often asked in the exam, is Parkinsonism. Please listen to this lecture very carefully. Parkinsonism, it's a disease of the old age, more than 60 years. So basically there is a dopaminergic neurons over here like this. These dopaminergic neurons will get degenerated. When these dopaminergic neurons get degenerated, what happens is there is basically